Hello and welcome to the patient information sessions on inflammatory arthritis. My name's Sarah Sachs and I'm one of the rheumatology consultants at Buckinghamshire Healthcare NHS Trust. In this series of presentations, we hope to provide you with a greater understanding of your condition. We're going to cover some general information about inflammatory arthritis and what it is, the medications we commonly use to treat it, some self-management strategies, and we'll also be hearing from some of our therapists and podiatry team. Inflammatory arthritis is managed not just by the rheumatology team, but by a wider team of experts, sometimes known as the multidisciplinary team. These include physiotherapists, who help you to maintain the structure and function of your joints and muscles through exercise, and occupational therapists, who help you find new ways of doing everyday tasks at home and at work. And of course, at the centre of this is you, the most important person. In our team at Buckinghamshire Healthcare NHS Trust, we currently have 6 rheumatology consultants who work across sites at Stoke Mandeville Hospital, Wickham and Amersham hospitals, and we also have 6 specialist nurses. Arthritis means inflammation of a joint. Rheumatoid arthritis is a type of chronic autoimmune disease where the immune system attacks the joints. So what do we mean by autoimmune? Our immune system is designed to defend our body against infection. Sometimes, however, the immune system becomes too active and mistakenly attacks your body. In the case of inflammatory arthritis, it attacks your joints, leading to inflammation. This is known as autoimmunity. Inflammatory arthritis is an umbrella term for a number of conditions, of which rheumatoid arthritis is the commonest type. However, others include psoriatic arthritis, where the arthritis is associated with a skin condition called psoriasis, axial spondyloarthritis, where the inflammation predominantly affects the spine, and enteropathic arthritis, which is seen in conjunction with inflammatory bowel disease. Although we'll focus on rheumatoid arthritis in these presentations, as it's the commonest form, most of what we tell you applies to the other forms as well. Rheumatoid arthritis is a chronic autoimmune condition which causes pain, swelling, and stiffness of the joints. It affects around 1% of the population, and it's 3 times more common in women than men. It can occur at any age, but it's most common between the ages of 40 and 60. It usually affects the hands, the feet, and wrists in a symmetrical fashion. The chronic inflammation of joints has the potential to cause damage to the cartilage and the bone around the joint. In addition to the joints, other organs can be affected by inflammation, such as the lungs, the heart, or eyes. Psoriatic arthritis is another form of inflammatory arthritis associated with skin psoriasis. It's also characterized by pain, swelling, and stiffness or one or more joints, and it can be associated with sausage-like swelling of the fingers or toes, as you can see in these pictures. Psoriatic nail disease can occur, which results in pitting of the nails or separation of the nail from the nail bed. And in addition to the joint inflammation, patients can also experience inflammation at the point at which tendons or ligaments insert into your bone, and this is called enthesitis. Although the cause of inflammatory arthritis is unknown, we know that 2 main elements are involved. These are genetics and environmental factors, which interact with each other to increase the risk. Certain environmental factors have been identified which may trigger the onset of rheumatoid arthritis, such as infections. Smoking also increases the risk of rheumatoid arthritis and may lead to a more aggressive form, which is more difficult to treat. In most cases, the symptoms of rheumatoid arthritis start gradually, with pain and swelling around joints associated with stiffness, which is worse in the morning or after inactivity. Other symptoms, such as fatigue and flu-like symptoms, are also very common. In order to better understand what rheumatoid arthritis does to the joints, it can be helpful to first look at a normal joint. So a joint is the place where 2 bones meet. Tendons join muscle to bone and allow the joints to move. Cartilage covers the ends of the bones. Between the cartilage of 2 bones, there's a small amount of thick fluid called synovial fluid, which helps to lubricate the joint and allow for smooth movement between the bones. The synovial membrane is the tissue that surrounds a joint, and the outer part of this is called the joint capsule, which gives the joint stability. In people with rheumatoid arthritis, antibodies are formed against the synovium, which is the tissue that surrounds each joint. This causes inflammation in and around affected joints. Over time, the inflammation can damage the joint, the cartilage, and parts of the bone near to the joint. This is in contrast to osteoarthritis, which is caused by the breakdown of the cartilage at the ends of the bones. If rheumatoid isn't treated or is inadequately treated, it can cause irreversible damage to joints and lead to disability, and this used to happen often. But today, the management of rheumatoid arthritis is very good, far better than it was even 15 years ago. Although there's no cure, most people diagnosed today can expect to lead full and active lives once the disease is under control. These hand x-rays show another example of the joint deformities that can occur if the inflammation isn't adequately treated. As mentioned earlier, rheumatoid arthritis can affect other organs in addition to joints. These include the eyes, where dryness and inflammation can occur, the lungs, the skin, and the heart. At each visit, we'll assess for these other complications. There's no single test to diagnose rheumatoid arthritis, and it will rely on a combination of your symptoms and what we find when we examine you, together with supportive blood tests and imaging. Blood tests may show elevated levels of inflammation, and the two markers we most commonly use are CRP or ESR. We also test for autoantibodies, called the rheumatoid factor and anti-CCP. However, it is important to note that not everyone with rheumatoid arthritis will have these antibodies, and around 30% of people diagnosed with rheumatoid won't have a rheumatoid factor. X-rays look at bones and enable us to see damage or destruction to the joints. Ultrasound is helpful at picking up inflammation in the joints, and MRI scans give us a more detailed view of the joints and their surrounding structures. To sum up so far, rheumatoid arthritis is a long-term condition. Although there's no cure, we aim to achieve remission with treatment. The condition has a tendency to fluctuate, and you may experience flares, which may, for example, be triggered by infection or stress. You will learn to understand your own body and develop strategies to manage flares. And if the flares are more severe, then we're here to help you. Although we can't cure rheumatoid arthritis, we have many effective treatments. We aim to relieve symptoms and treat the inflammation in order to prevent the long-term complications and joint damage. It's important that we treat your condition early to improve your prognosis. We have many strategies to help you manage your arthritis. Alongside all of the medications, which we're going to cover in more detail in our next presentation, we involve other members of the multidisciplinary team, such as the physios and the occupational therapists, and we also have access to pain management and joint injection clinics. After your initial diagnosis, we'll review you in clinic at regular intervals. This will include 6 to 8 weekly clinic appointments, which will alternate between seeing the doctor and the nurse specialist. At each visit, you'll be reviewed and examined. We'll measure your disease activity using scoring systems, and we'll review and potentially modify your treatments. We aim to see you regularly until low disease activity or remission is achieved. You may come to hear about the DAS28 score, which is a score we use in clinic to assess how active your rheumatoid arthritis is. This gives us an indicator of how well your treatment is working. The DAS28 is based on the number of tender and swollen joints you have, along with your blood test inflammation markers and a global health score out of 10. The PSARC is a scoring system for assessing psoriatic arthritis activity, and it's also based on the number of tender and swollen joints and a global score out of 5 as judged by you and your doctor or nurse. If you have any questions or concerns about your symptoms or treatment, then we have a helpline run by our rheumatology specialist nurses who can answer your queries or direct them to the doctor involved in your care. It should be stressed that this is not an emergency helpline, but we do aim to return your call within 5 working days. Other resources which may provide help and support are NRAS, which is a national patient-led UK organisation specialising in rheumatoid arthritis and juvenile arthritis, and Versus Arthritis, which is a large charity dedicated to supporting people with arthritis. In summary, inflammatory arthritis is a group of chronic autoimmune conditions of which rheumatoid arthritis is the commonest form. Contrary to belief, rheumatoid arthritis can occur at any age. Everyone's disease is different and may respond differently to treatments. In some cases, other organs can be affected. It's important to treat the disease effectively to avoid the permanent joint damage that can result from chronic inflammation. With prompt diagnosis and the right treatment, most people diagnosed today can lead normal lives with their symptoms under control. Thank you for listening.